Hi, everyone. I'm Camellia, an APRN, a psychiatric mental health nurse practitioner, a nurse enthusiast, and coach. And one thing that I want to actually talk about today is a nursing skill that we don't talk about as often. It actually takes me back to my nursing school days. My final year in nursing school, we had to write a paper and a research paper on specific, nursing skills. And one of the skills that I wrote about was active listening. And there was a lot of research. I remember doing research on the topic, and so much came up then. But never did I really kind of think about how I would use it as a nurse throughout my career. So active listening, of course, is very important because it allows us to, as nurses, sometimes develop an open relationship with our patients so that they feel comfortable sharing information. Active listening also means that we can sometimes read between the lines. And it also means that, we are giving the patient the best that we can. And a lot of that comes through what they say and what they do. We can gain lots of their history from just those things. And their history, of course, is important because it guides their treatment. And I, again, as a nursing student, as a nurse, this active listening skill really has popped up quite a few times. Now more so than ever, because I'm a nurse practitioner and I work in mental health. And of course, rapport and relationship building and trust is so important in this area of nursing. But there are a few things that I want to talk about around active listening and how we can possibly really show that we're actively listening to patients. Most of what we do, whether we are a bedside nurse or a provider, an advanced practice clinician, a nurse practitioner, an APRN, most of what we do is driven by what the patients say. And so we have to be able to listen with our ears and listen effectively so that we can relay the information or that we can actually provide treatment. And so there's a few things that I want to talk about here. Number one is giving your patients undivided attention. Now, we all know that in most instances, especially if you're a provider, you have a time slot for patients. You don't have extensive amounts of time. And so most of us, our efficient process is to type as we are actually in with the patient, to write as we're in with the patient. And it doesn't mean that those things have to go away. But what I've found that can be helpful is patients knowing that we have their undivided attention. And we can show that by some of the small things, such as showing them eye contact. Looking from your computer screen every once in a while if you are a person who's typing as you're getting the information from the patient. Other things like, glancing up if you're writing every once in a while to let the patient know, giving them a head nod to let them know that you're listening to them. A lot of times patients will only share information that they're comfortable sharing, but they also want to feel like that they have our undivided attention. Okay, so undivided attention is number one. Number two is body language. So I will say that with active listening, body language goes both ways. So if we are looking at body language of a patient, it's important for us to use that as a way that we listen to patients. And there's studies out there that say that about 75% of our actual communication happens through body language. So if you are a nurse or if you're used to doing assessments on patients, if you're a provider, a nurse practitioner, some of that means reading between the lines and noticing those changes in body language with your patients. Sometimes it may mean frowning or, having a more tense posture, or it could also mean having a puzzled look like they don't quite understand what you're saying. And so all of those are telling, signs of something that we should probably explore further. So what I found to really kind of give that more attention is to actually call that out to patients. And I say things like, I noticed that your body language changed when I said that. What stands out? Or I noticed that you seemed a little unsure about that when I said that. So tell me more about that. So calling that out when it actually happens can actually help to resolve any confusion. It can help to resolve anything that feels like it's still unexplained for the patient, because a lot of times patients may not actually raise their hand to say that they don't understand or that they do feel uncomfortable with something. So paying attention to body language from the patient, but also when we're actively listening, paying attention to our own body language. So that means not frowning. That means, not showing, judgment with our expressions. That means feeling not being closed. So, not crossing your arms, things like that, really help us to portray that we're listening and that we're open. Other things like sighing. I can tell you, being on a patient side of things, I've had a few providers that actually sigh. It may not mean anything, but to a patient, that means that it's kind of like the provider's exhausted, or that they don't really want to hear what you have to say, or that you're giving them too much, or they're overwhelmed. It just doesn't sit well. So pay attention to your own body language and what you're giving off or could be giving off to the patient. Okay. Remember, this is all about the patient feeling comfortable enough to give us information that we need for their treatment. Okay. Acknowledgement, that just includes just being able to listen and not listening to respond. So not being reactive with everything the patient has to say, not countering everything that the patient has to say. And also with acknowledgement, the way that we can help patients to know that we do get what they're saying and that we want to be clear on what they're saying is to actually paraphrase and summarize what they've said. And so in some ways, it's giving them back what they've said to us so that we can clarify to make sure that we're understanding what they're trying to say. That can be huge. And then lastly, a non-judgmental attitude. So that's important, of course, because patients, all the information that they tell us is confidential, but we hear and see a lot. We hear things that sometimes we are surprised by or that can take us aback. But a lot of times what we want to make sure is that we're not showing judgment, because that can cause a patient to not share information to the next provider that they need to be sharing it with, or it can also just cause the patient to kind of be closed off and not reveal the information that's necessary for us to know. Okay. And ultimately, this is about respect and trust. So if we can develop trust with our patients, then I think that's the most important thing for them to be able to feel listened to and to feel comfortable sharing confidential information with us so that we can provide the best possible care for them. So don't want to put it all on the patient as their responsibility fully, but I also don't want to put it all on the provider. But the way that we can develop that mutual trust and respect has to do with our active listening skills. So I really wanted to touch on this because it's not something when we think about nursing skills that we actually, focus in on a lot, but it's probably one of the most important skills that we use every single day. So whether you're a bedside nurse, you're a nursing student, you are a provider, maybe you're a medical assistant or even a CNA, and you are responsible for getting history and information from patients. Just really think about your active listening skills, how you are giving patients your undivided attention, how you're showing your body language that shows them that you're open and that you're listening, and how you're paying attention to their body language to use that for your assessment. How you're showing that you're acknowledging what they're saying, that you're summarizing and paraphrasing what they're saying, that you're listening not to respond, but to actually listen to what they're telling you. And then lastly, not showing judgment. So maybe you're doing this every day. It's something that I'm endeavoring to continue to focus and be intentional about, because it's very, very important in the role that I practice every day, And so let me hear from you guys. If you have anything else to offer around active listening, please let me hear from you. I'm all about dialogue, and I just want to continue that going forward for the betterment of ourselves, for the betterment of our practice, and the betterment of the patients that we serve. You guys have a great day.